Hello, my name is Dr. George Roth, and I thank you very much for inviting me to speak to your group. This is an important area of concern, which I'm going to talk about today, which is related to the assessment and treatment of concussions and traumatic brain injury. And I hope to share with you some of the insights we've gained over our many years in practice. I've been in practice for over 45 years in the fields of physical medicine, chiropractic, osteopathy, and naturopathic medicine. And I've been teaching various forms of therapy, including what I'm going to be talking about today, for many years. So the topic today is the use of matrix repatterning for the treatment of concussions and traumatic brain injury. I'm going to share some slides with you to illustrate some of these points that I wish to make today and some of the preliminary results of our research. So the use of matrix repatterning for the treatment of concussions, which is our topic today, a very important area of concern for any clinician dealing with traumatic brain injury. I'm going to share some statistics, mainly US-based. First of all, that traumatic brain injuries are occurring at the rate of one person every 15 seconds in the United States, usually young people. And every year, approximately 100,000 people die from traumatic brain injury, and 500,000 more are permanently disabled. Many of these are not being diagnosed, of course, and they're less severe, but they do impact on function and the quality of life. 80,000 people experience the onset of long-term disability following a severe brain injury annually. And of course, those are severe brain injuries, and there are mild to moderate traumatic brain injuries, which of course have significant effects as well. And approximately 5.3 million Americans, more than 2% of the US population, are living with a disability resulting from traumatic brain injury. And this is significant in terms of cost from a point of view of lost productivity and healthcare costs, amounting to approximately $30 billion a year in the US alone. So it's a real problem, significant problem. The purpose of today's talk is to provide you with some information about what we're doing using this technique called matrix repatterning. And the basis of that is to understand, first of all, how we are constructed at a very basic level, at the deepest level within the body. And this is the framework for understanding how structure and function coordinate. So I'm going to introduce the concept of biotensegrity, which is a term coined by my good friend, Dr. Stephen Levin, who's a retired orthopedic surgeon based in Vienna, Virginia. He and I have been collaborating for over 30 years, presenting to various groups in the US and Canada. And if you are interested in his work, you can check it out at biotensegrity.com. He introduced me to this concept of how cells are constructed many years ago, which opened the door to me developing this technique to allow us to provide a much more powerful therapeutic intervention. And this is based on the idea of tension and compression elements within cells and between cells based on the structure of various proteins within the cell, within the cytoskeleton and the extracellular matrix. This was further clarified by Dr. Donald Ingber at Harvard University, who is a cell biologist and provided deeper insights into the structure of the cells, which can actually be seen on some powerful microscopic views, which we'll look at in a minute. But basically, this illustrates the fact that cells within cells, there is a hardwired framework that allows for the very efficient functioning of the cell. All of the organelles you can see here are suspended in this protein framework, and any deformation or alteration in the shape of the cell actually alters physiology. And these are some of the microscopic views of the cytoskeleton. In addition to the cytoskeleton, we also have a significant interconnection between cells called the extracellular matrix, composed of various forms of proteins and polysaccharides that link one cell to another. What's important to understand that this interconnected nature of the cells is really something that is real, and why many symptoms occur some distance from the original injury. You can check this for yourself by literally just sitting in your chair there and noticing with your eyes closed how the tension in your neck and shoulders feels. And then while you're doing that, go ahead and clench both of your fists, and notice how much the tension increases in your neck and shoulders, and then relax your hands and notice the difference. And that illustration is the idea here that the fist tension is actually simulating what would happen with an injury somewhere else in the body. And you can actually feel this throughout your entire body, the neck and shoulders being one sensitive area that allows you to feel that. So life on planet Earth is fraught with a lot of potential injuries. We have this force of gravity, forces of momentum and motion that often cause us to collide with various parts of the physical structure around us, the ground, other people in sports, for example, the inside of a motor vehicle in a motor vehicle collision, and other sources. Unfortunately, nowadays, with all the conflicts going on, we have various people suffering from concussion due to impact trauma to the entire body for sure. And we'll specifically focus on the head today, but I'll give you a sense of how this really affects many areas of the body. The key here is to understand that the forces generated by impact in particular are going to have a bigger effect on dense materials. And the densest materials in the body literally are two in nature. One is water, which is fluid, and the other is bone. And so this is going to be, material will absorb the energy of an injury more than a softer material like muscle and fascia and ligaments, which can dissipate that force more easily. Now, the deepest layer of fascia in the body is surprising to many people, but it's actually bone, which we can refer to as mineralized collagen. So it's a fascial structure, but in fact has a dense nature due to the mineral component, the hydroxyapatite that's embedded in this fascia. And because of that, I refer to it as the forgotten fascial element. In fact, it is a common area of injury that is often missed because it's not recognized for what it is. And this is something I noticed being something interesting many years ago when I taught human dissection at the postgraduate level, and I also looked at it through radiographs, noticing that the bones on one side of the body were significantly larger than the other side. And I wondered what that meant, and really was not clear on that until I actually started using some techniques that were directed to bone and noticed that they actually improved. They actually shrank in size, which was a big shock to me. And this is something that has really been clarified and verified by researchers at the University of California, where they applied force of impact to bone, and using a very powerful microscope, were able to see the protein structure inside the bone expanding during impact. After the impact, however, the enlargement persisted, and this is something that they were able to verify. And I've contacted Dr. Paul Hansma, for example, and he verified this and recognized our work in being able to change this. In the skull, this is significant as well, because deformation of the skull due to direct impact can alter its shape, which is something we actually can observe in practice. And you may start to notice that when you inspect some of your concussion patients. So one of the key elements here is that the dense fluid-filled structures within the body are also significant areas of absorption of energy from impact. So this involves not only the head, but also the trunk, the fluid-filled organs, inside the trunk, which actually absorb energy similar to the cranial vault. These are fluid-filled structures, so that an impact coming into these areas of the body actually creates two impacts. One is the incoming impact, and the other is the outgoing impact as these areas expand. And so you've heard of internal injuries where you'll see enlarged livers, spleens, kidneys, hearts, and so on. And this, in fact, occurs within the head as well. The outgoing impact actually is transferred to the bone structures around them, so including the rib cage, the spine, the pelvis, but also the interior of the cranium. And these patterns of injury, because of their interconnected nature, which we mentioned earlier with respect to the cytoskeleton and the extracellular matrix, means that an injury in one part of the body can actually cause mechanical stress to be transferred to other areas of the body, causing symptoms elsewhere, which has been the challenge for many practitioners to determine where is an injury really coming from. And that's been something we've been able to address using this technique that we've developed. So this is transmitted through the biotensegrity matrix, as was illustrated earlier when you did that little exercise. It's basically this continuous nature of the extracellular matrix, which allows for that. But this causes symptoms in other parts of the body, leading to pain and dysfunction throughout the body. And you can see here just an illustration of the bone structure here, let's say falling on your hip, causing expansion of the femur, but that in turn causes mechanical stress to be transmitted to the neck, the shoulder area, the rib cage, the low back, the knees, and so on. And so even though this is what we call a primary restriction in the bone, the pain can be, and other symptoms can occur throughout the entire body, right? And treating those other areas that are secondary may in fact be relatively futile. So the question is, how do we actually locate the source of injuries? Well, I sort of hinted at it when I talked about the change in the shape of the skull, but in fact, structures throughout the body, especially the bone, reflect these changes when you look at it closely. If you look closely, for example, at the shape of one of your knees and another, or look at your, someone in your family or a patient, you'll start to notice that these bone structures are often asymmetrical, which we believe is associated in most cases with some form of injury. This is something we carry on in our work and looking at not only the head, but also the bone structures in the extremities and the spine and the pelvis and the rib cage. In addition to that, we can actually measure those specifically to monitor those changes as we proceed with treatment. Another key element that I discovered many years ago is that there are bioelectric changes in these structures when they're injured. This is a key to determining the location of many of these primary restrictions. And fortunately, we've been able to work with a number of scientists to develop technology that allows us to determine the location of these injuries, even if they're not obvious from the bone size changes. So we actually detect the electronic fingerprints of injury using a unique device called an alternating polarity concentric magnet, which we've actually determined generates a form of microcurrent when applied to the body, and therefore stimulates the actual correction of the underlying restriction, which causes electronic distortion in that area. So literally like turning the switch on to create more current through the area, which releases some of that local tension, which we can use as part of our assessment. So this creates a cascading bioelectric charge that travels through the material and stimulates the microcurrent in the tissues. So this has been verified to reduce pain and stimulates tissue repair. There are 4 double-blind studies that illustrate that, supporting the validity of this technique using this bioelectric influence on the body for assessment and treatment, as we'll illustrate a little later. So the bioelectric assessment is carried on by using this interconnected nature of tissue. By applying this alternating polarity concentric magnet device, we can actually stimulate the microcurrent and therefore verify the location using tissue tone response throughout the entire body. So we refer to the scanner device and matrix mag scanner and the indicator. There's a little issue with the size of my font there, but you can ignore that. So treatment is the application of a principle which we refer to as piezoelectricity. Now, piezoelectricity means that there is pressure that can be applied to certain substances to stimulate the movement of electrons. And this has been well studied in materials like ceramics and metals, but also in bone. And bone is recognized as a crystalline structure that when it's deformed will inhibit the movement of electrons, as illustrated on the right side of the diagram here. And the normal pattern of movement is on the left side, but by compressing this element, we can actually stimulate the piezoelectric current in that tissue, which can resolve certain injuries. And this is the principle of piezoelectricity, the voltage you see here going up as the material is compressed. All right, that's the nature of crystal radios and so on. So by applying gentle compression, we can induce that. At the same time, we can also use the application of the matrix mag scanner and the induction field it generates to support treatment as well. I'm going to show you an illustration here of a case that we treated a number of years ago, a young lady who came to one of our practitioners and had significant bone damage. And this was a non-union fracture that persisted for at least 5 years. The young lady was unable to ambulate or walk without assistive devices. And eventually a metal rod was placed in the bone to provide some support, but the bone never healed. And the diagnosis was fibrous dysplasia or fibrous dysostosis. And this young lady was really in a dire state. And then finally, she came to one of our practitioners who was able to apply matrix repatterning. And this is the result of 6 treatments. We can see the bone has healed substantially. Eventually, the metal rod was able to be removed, which was actually causing distress because it was poking out at her ankle. And now this young lady is functioning normally without assistive devices. So this is a really good example of what can be done with the application of this combination of containment and entrainment using the pressure and the bioelectric influence to support a normal structure of bone. Another example here, a young hockey player who was commented by his parents that he was unable to walk comfortably. He was hobbling up the stairs, 15 years of age, hockey player, and he was very carefully being monitored for his bone structure because of another genetic condition. And after 3 or 4 treatments, he was able to function much more painlessly. And his parents commented that he was flying up the stairs. And on re-examination using radiography and with very careful attention to detail as far as size, the specialists who were following him were marked at, they were astonished actually at the change in the size of the bone after treatment. It actually shrank by 5 millimeters. And if you look closely, you can see that the actual shape of the joint expanded on the medial side in particular, and the valgus deformity reduced as well because of the normalization of bone structure. So we've seen a number of cases of this over the years. Now, with cranial injury, there are various things that we postulate as to what might be inducing these injuries. So if we look at this diagram of what might be occurring during a cranial injury, an incoming impact from, let's say, the outer part of cranial vault, direct trauma, causing a deformation of the bone, similar to what we see with other bones in the body. But the expansion actually, because it interacts with the fluid contents of the brain, causes a concussive force of the outgoing fluid pattern impacting outward into areas of the skull as well at the same time, leading to expansion of various areas within the skull in those areas of prominence. And that can cause deformation and stress on neural structures surrounding the brain and outward in various different directions. And this can actually be observed when you examine the patient. And by correcting these, we see significant resolution of various symptoms, which could be measured neurologically, and some other methods, which I'll describe a little bit later. In addition to this, impact can also occur from the body coming up through the cervical spine into the cranial base. So the gentle treatment application here is really just manual therapy along with the bioelectric stimulation. This is one of our practitioners who's applying this to the young lady here, and he actually specializes in concussion treatment in the US. Now, what we did a number of years ago was using a neurosensory device called the Brain Gauge, which was developed by Dr. Mark Tomerdahl and his team at the University of North Carolina. It's a tactile sensory device which actually tracks various levels of neurosensory improvement with the application of various forms of therapy. Dr. Tomerdahl developed this a number of years ago, and actually his observations using this measuring device with our patients led him to make a comment that this was providing significant improvement that he was actually able to verify. This is a case of a young lady who had been really suffering from a motor vehicle collision, had cognitive, visual, vestibular disorders. She was pain sensitive, light and noise bothered her significantly. She was unable to pursue a postgraduate program in occupational therapy as a result of that. And in fact, after she was treated, she was able to pursue that career and finished her occupational therapy certificate, and also became a matrix practitioner, matrix repatterning practitioner in Alaska. So it's been very gratifying to see her progress. So this is a couple of illustrations of impact injury. Here we have anterior impact illustrated before treatment. We can see a little bit of a depression here on the left side of the frontal bone. This is literally just one treatment. It's surprising how quickly these things can change. And this is following one treatment. If you notice the expansion of the frontal bossing on this diagram on the right. So this is the change in the structure that's illustrated just after one treatment. So it's not surprising that these people do progress fairly quickly once the structure is restored. Here's another example of an infant with a posterior depression showing up before treatment on the cranial vault. And then following treatment, you can see even a little bit of restoration of that curvature to the posterior aspect of the cranium, which we see quite commonly changing with treatment. So one of the researchers who's been looking at this over the recent years is Dr. Norman Doidge. He's the author of a book called The Brain That Changed Itself, which is focused on neuroplasticity. And in his recent book, he talks about the use of matrix repatterning. This book is called The Brain's Way of Healing. And his comments in the book talk about him viewing it prudent to have a matrix assessment after any blow to the head. He often says this should be the first intervention. And observing such cases has led me to hope that one day matrix repatterning will be routinely applied in hospital emergency departments. And he was able to observe quite a few cases and followed quite a few cases over the years, and actually took some of the training and was able to actually apply the technique himself. And so this is something that has expanded the reach of matrix repatterning because it's a best-selling book that people have read from around the world who are now seeking matrix repatterning treatment for concussions. So the question is, why repattern? So injury changes the cell structure. We know that the puzzle pieces don't fit. We have deformation of bone. Things don't function, in terms of any joint in the body. If you have injury to the hip, for example, or the shoulder, now the size of the epicondyle, the condyles and the epiphyses are actually altered. We see joint degeneration happening very rapidly. And in the skull, we have deformation related to intercellular communication affecting neural tissue and so on, which we see rapid resolution of neural functioning through testing, as we talked about here. And the problems just keep returning unless those structures are corrected in terms of structure. Okay, so restoring the ideal size and shape of bone, including that of the head, is important. Improving intracellular and neural communication, and this is allowing the puzzle pieces to fit. So we've been able to apply matrix repatterning to many conditions over the years for various conditions, back pain, hip pain, knee, ankle, foot, neck and shoulder pain, wrist, hand injuries, carpal tunnel syndrome, headaches and concussion, as we've talked about today, TMJ, dental issues, trigeminal neuralgia, for example, various forms of organ dysfunction, including incontinence and digestive disorders, esophageal reflux, urinary tract function. Snoring and sleep apnea is a very large area that we've been able to help with, which is often a mechanical issue. And of course, chronic pain in many forms. So our goal is to help practitioners from all over the world gain access to these techniques, and hopefully this is something that your group will be able to pursue in the future. We look forward to working with you in any capacity that we can to support your learning. You can contact us through info@matrixinstitute.net, and also check our website, matrixinstitute.net, where you'll have access to quite a number of videos and articles which clarify and will highlight some of the benefits of matrix repatterning and how you can actually pursue some training, much of which is online training, and hopefully we will have some in-person training in Europe in the coming years. So we look forward to hearing from you. We hope this presentation was helpful. Thank you for your time. I really appreciate the opportunity to connect with you. Thanks again. Bye for now.